Hi, before I start with my presentation, I'd like to take a moment to thank Dr. Stephen White for all of his help with getting my presentation for the URS together. Thank you, Dr. White. I really appreciate everything. Also, I'd like to give a special thanks to Tara Clover, a graduate student in the lab, who was also very helpful with getting my poster together. Thank you, Tara. Thanks, both of you guys. I really appreciate everything. Now for the presentation. My name is Sequioa Smith, and I'm an undergraduate research assistant in Dr. Stephen White's psychopharmacology lab at Sam Houston State University. The title of my project is the evaluation of the metabotropic glutamate receptor 5 antagonist 2-methyl-6-phenylethynyl pyridine, MPEP, for antidepressant effects in an avian model of treatment-resistant depression. Our lab's goals are to develop, validate, and utilize animal models of psychiatric disorders for research. Meeting these goals will help us to better understand the etiopathology of psychiatric disorders, thus better helping us to identify novel targets for the development of pharmacotherapies. According to the World Health Organization, more than 300 million people worldwide suffer from major depressive disorder, or MDD. MDD is a chronic and recurring illness, and the World Health Organization also reports MDD is the leading cause of disability worldwide. Currently, it is reported that nearly half of MDD patients do not have effective treatment options. Depression affects a person's ability to live and to work, and approximately 6 to 7% of full-time US workers have experienced major depression within the past year. That's according to the American Psychiatric Association. They have also reported the total economic burden of MDD is now estimated to be over $210 billion per year. Clinically available medications such as selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs, only improve symptoms in about 2/3 of patients. And this is after several weeks of treatment. These types of antidepressants attempt to elevate the synaptic availability of serotonin and norepinephrine. Clinical findings demonstrate that between 40 and 60% of MDD patients fail to experience symptom relief following adequate regimens 4 to 6 weeks of typical antidepressants. The FDA deems that MDD patients who fail to respond to at least 2 antidepressant therapies resistant to treatment. These patients are then categorized as treatment-resistant depression, TRD. Because of the therapeutic lag and the low response rate of current antidepressants, our lab is focused on investigating other potential targets for the development of faster-acting, more effective treatment options. Recent research suggests that the glutamate system may play a role in the etiopathology of major depression. Decreased levels of glutamatergic metabolites in the medial frontal cortex are linked with the pathophysiology of depression. These findings are in line with the hypothesis that depression may also be associated with abnormal glutamatergic neurotransmission. Glutamate is an important neurotransmitter, and it's present in over 90% of all the brain synapses. It is a naturally occurring molecule that nerve cells use to send signals to other nerve cells in the central nervous system. Glutamate plays an essential role in normal brain functioning, and its levels must be tightly regulated. The glutamate system includes a total of 11 receptors. This includes 3 ionotropic receptors and 8 metabotropic receptors. Preclinical rodent models of depression have investigated the modulation of the metabotropic glutamate receptors as possible targets for potential antidepressant effects. Most notable is N-methyl D-aspartate, NMDA receptor antagonist ketamine. When given intravenously in low doses, ketamine has demonstrated rapid and sustained antidepressant effects for treating MDD bipolar depression, and TRD. However, ketamine has the potential for abuse and may cause cognitive impairments, making it not a long-term treatment option. Even so, ketamine's successes has led researchers to probe the glutamate receptors for a potential antidepressant effects. However, these effects have not been evaluated in a preclinical model of TRD. The model we will use for this study is the chick anxiety model. This model involves an isolation stressor that initially produces a high distress vocalization or devoc rate, which is a characteristic of an anxiety-like state, which is then followed by a lower devoc rate in the last hour of the phase or the isolation period, the 31 to 90 minute period of the isolation stressor, and this simulates a behavioral despair, a characteristic of depression-like state. This study utilizes the chick anxiety depression model to evaluate the metabotropic receptor 5 antagonist 2-methyl-6-phenylethynyl pyridine, MPEP, in the treatment-resistant Black osteolorp genetic line for potential antidepressant effects. We will use socially raised at 5, 6, and 7 days post-hatch Black osteolorps. 15 minutes prior to exposure to an isolation stressor, they will be administered either a vehicle, ketamine 10 milligrams per kilogram, or one of 3 doses of MPEP, 1 milligram, 3 milligrams, or 10 milligrams per kilogram of MPEP. This is a dose-dependent study. This study will analyze the data collected to see if in the 31 to 90 minute phase, or the depression-like phase, the chicks increase their callings to their conspecifics. A dose that produces a statistically significant increase in the devoc rate compared to the vehicle-treated chicks is considered to possess antidepressant effects or attenuated behavioral despair in the model. Our table shows, or my table shows here, the devocs across the depression-like phase at the 31 to 90 minute mark. Now, this is what we expect to see. This isn't what we have collected, but this is what we expect. The bottom on the graph shows the vehicle ketamine 10 milligrams per kilogram and the 3 doses of MPEP, 1 milligram per kilogram, 3 milligrams per kilogram, or 10 milligrams per kilogram. We hypothesize we will see a significant increase in the devocs for the 10 milligram per kilogram dose of MPEP. That's similar to the 10 milligram per kilogram dose of ketamine. Rodent models have been criticized for their predictive validity and their translational relevance. And that's why this study is so important, because here we show the metabotropic receptor 5 antagonist, MPEP, possesses antidepressant effects in this novel TRD model. These results will align with other preclinical findings and suggest that the metabotropic glutamate receptor is a novel target for the treatment of TRD. These findings will further validate this avian model as a tool for screening novel compounds for TRD. If there are any correspondence, questions, or concerns with the poster, please feel free to email myself, Sequioa Smith, at sjs085@shsu.edu, or Dr. Stephen White at sww012@shsu.edu. Thank you so much for watching my presentation.